Welcome everyone to the session on precision nutrition in oncology. So this presentation draws on clinical insights and best practices from Indian hospitals combined with evidence-based guidance from major international oncology and nutrition organizations. So we will be also talking about nutritional strategies applied across different cancer care journeys, and we'll discuss some information that we get from IAPN India, SPEN, ESMO, and the ASCO standards, so that we are aligned with the best practice internationally as well. Coming to myself, Dr. Eileen Canday, and today we're going to talk about precision in cancer nutrition. Now, when we know that 40 to 80% of our cancer patients become malnourished during treatment, which is consequences to poor nutrition or treatment effect or intolerance to therapy, we have to understand that the evidence based care and support is very essential in this aspect, and therefore we have various guidelines, including the IAPN India guidelines, to understand this topic better. So, whilst we understand that we need to do a nutritional assessment in order to first find out where the patient lies, whether it's SGA, MUST, or the NRS, we understand that this is a structural interventional plan and where the recommendations from the guidelines are important. What's coming to the first and foremost, the aspects that we deal in India today, and especially to manage the impact of nutrition and quality of life through the diet is very crucial. So when a patient faces symptoms like or complications with medications like nausea and vomiting, we do recommend like small frequent meals, or we stick to an easy digested food. So we do offer them simple foods that are easy to digest. Sometimes if some patients have told us that ginger tea helps them feeling better, or ginger water helps them feeling better. If a patient has diarrhea, we say that eating foods like oats, banana, apples would help them. We also teach them how to make the ORS, that is oral rehydration solute. Avoid spicy, high fiber, or sorry, high fat foods. If they face constipation, we also look at adequacy of fluid intake, adequacy of fiber foods, give natural remedies which have got high fiber foods from, say, prunes or papaya. Now, these are some of the practical suggestions we give for patients who are managing treatment complications. So the approaches sometimes we use is a patient who cannot eat adequately. So we do offer them oral nutrition solution, where we do give them oral nutrition supplements. Sometimes we also offer them blenderized foods like a khichdi, or in certain situations where we need a aggressive nutrition support, where person is not able to take even 50% of their adequate calories. That's when we look at nutrition support from an NJ, or a tube feed, or a peg feed. And these the kind of tube that is used, of course, is based on how long the patient will be having difficulties, or the patient is check the patient's swallowing capacity. So we look at different formulas, whether it is a polymeric formula or something that will help the gastrointestinal tract. Now, we cannot forget that a lot of our population are children with cancer, and these children have a protein and a calorie requirement as per their body weight. So, screening every child at diagnosis within the first 24 hours if they are hospitalized is essential, but even at every hospital visit. And as we know, one size does not fit all. Children have different wants, needs, and taste requirements. They have different texture requirements, so we have to work with their food preferences, with their flavors, and work closely with their family to decide the strategies that work best for them. Also, when it comes to India, we do face a very, very unique challenge in clinical nutrition, and especially in the scenario where dietitians and specialists are really not many in smaller setups, especially in the smaller cities where even supplements are very expensive and people cannot tolerate them. That's when we look at traditional foods to help patients get out of malnutrition. So, yes, many patients have limited health literacy and making it harder communicate, especially to them, the kind of social media output that is there with regards to what to eat and what not to eat and what is a superfood. Actually has a lot of influence on these people. So the real opportunities are to focus on affordability, locally available foods that are also nutrient dense. So we do encourage eating home foods like dal, eggs, yogurt, and add some high protein, high calorie, dense foods like nut purees or nut paste to the mixture. Yes, many patients do ask me about the Ayurvedic role, and yeah, we do try various ways, but nevertheless, we should explain to the patient that they should not leave, doing their treatment in the most appropriate manner, so that they do not. The outcomes are not, hampered or touched. When we have people in the community to help us, whether it is a nursing or a trained person, we should take their help, because it's not possible for the dietitian to be there all the time for the patient. And these are the people who are in touch with them. So sometimes it's essential that we also, educate our community, including the health workers, including some of the nurses and caregivers. So one thing is that what we have to prevent as dietitians is cancer cachexia, which the progressive sometimes is not in our hands, but at least we can do our best to prevent skeletal muscle loss, which can be revised through nutrition. Body loses a lot of muscles through multiple simultaneous mechanism, and these breakdowns is, it cannot be stopped, and therefore we need to understand that the decreased muscle synthesis, whether it is actively derived muscle loss or hormone environmental shifts, like unfavorably, there is a drop in some of the hormones or change in the hormonal output. So the clinical consequences are very significant when patient becomes functionally weaker and dependent. They tolerate chemotherapy poorly, or some of them. Every patient's need to eat a protein is different, and therefore we have to explain to them what is the key mechanisms in which they can eat adequate protein in their diet. Beyond calories and proteins, also there is something else which is would really help metabolically, and that is about moduling the diet as per the different nutrients. Especially, a lot is spoken about the anti-inflammatory approaches, that is the EPA and the DHA. Even the ESPN, that's the ESPN guidelines, have said that using EPA or DHA to reduce the systematic inflammation is essential. Uh, Whilst we talk about insulin sensitizing strategies, so implement approaches that will improve glucose metabolism and reduce insulin resistance. So we can prioritize, even high quality protein. So as been recommended, that focus on leucine rich food sources, and these will support the muscle preservation and recovery. Talking about the gut, you have to look at how much and how well you can incorporate pre and probiotics to support the short chain fatty acids. Of course, there's a lot of evidence with regards to supporting the gut through short chain fatty acids. The other, when we talk about precision nutrition, we cannot ignore the fact of nutrigenomics and the role the genes that play in our lifestyle. So our genes, we know, is not our destiny, but they do matter, because The genetic variations affect how we process different nutrients and influence our disease risk. And that is why one diet does not fit all. Even talking about metabolomics, that is, gives us the real time snapshot of what actually happens in the body. And by measuring metabolites, we can see that the immediate effect of diet and lifestyle choices are not just theoretical, but they work together. And therefore, using nutrigenomics and metabolomics are the way to do personalized and precision nutrition care. Talking about nutrigenomics, that is all about how our genes and our nutrients interact. So the genetic variation affects how we metabolize different nutrients, and therefore here we talk about the SNPs, that is single nucleotide polymorphism. They are small genetic variations that can change how the enzymes work in our body, and these changes directly impact how we absorb these nutrients. So also, they affect the cellular signaling pathway and control our metabolism and health outcomes. Now, our genes are like the instructors or a manual for our body, where nutrients are the raw materials, and nutrigenomics helps us understand how these instruction materials interact to keep us healthy or diseased. Now, we are looking at certain other practical informations, whether it is the MTFHR variant or it is to do with, folate supplementation, B12 supplementation. Of course, nutrigenetics and nutrigenomics is a very wide topic. However, some of the aspects which we can add in our diet is quite clear. Even things like the APO genes, which they are the carriers of increased sensitivity to saturated fats, which of course lead to a reduced LDL clearance and therefore an LDL cholesterol elevation. So when we talk about the pro-inflammatory metabolic profiles, we talk about these dietary strategies for APOE genes, which will help to reduce by reducing saturated fats, butters, and processed meats. So there is then the need for a higher MUFA-based diet or a PUFA-based diet. That's what we call a precision nutrition. When we look at the evidence-based approach, to actually take care of nutrition. So, JAMA and some other studies have clearly published the role and the responses of high saturated fat intake in an APOE4 genes to individuals, making dietary modification particularly impactful for this kind of a genotype. Also, we know that same diet has different health outcomes for different patients. So, although our genetics play a very crucial role in how we respond to the food we eat, genotype guiding nutrition means tailoring diet recommendation based on the individual genetic profile. So this approach is particularly powerful in two areas. That is, one is the cardiometabolic health, where uh, you know whether it is the heart diseases or diabetes or metabolic syndrome, and oncology, where we talk about cancer prevention and management. So, by understanding someone's genetic makeup, we can move away from that one size fits all advice towards a truly personalized nutritional strategies. And this precision approach leads to a better outcome because recommendations actually match the person's body processes and nutrients. When we talk about metabolomics, that is the snapshot of what actually happens in our body at that moment or right now. So we measure all the small molecule metabolites that are produced in the cellular process, and this reflects the real time physiology and not what genes say. So it talks about the substrate utilization. So when the bodies can run on a different fuel source, that is glucose or fat. So some patients are glucose dependent and the others efficiently oxidize fat. So now these patterns tell us a lot about the metabolic flexibility and the health status. Now, talking about metabolic stress, okay, we can distinguish between cachexia and a muscle wasting. So an anabolic recovery state. So when we talk about, there is a difference in just cachexia and muscle wasting. So metabolomics here helps us to see someone in a catabolic spiral to building back. So dysfunction markers, like if you look at signs of insulin resistance in a metabolic profile, mitochondrial impairment shows how in characteristics metabolite patterns, they these are markers that help us to identify what actually has been broken at the cellular level. Also, when focusing on the metabolic phenotype, so patients present with a different body composition, which range from cachexia to sarcopenic obesity also. And these affects how they tolerate the treatment. So when we talk about tumor biology, tumor have different metabolic profiles, and some recycle on the glycolysis while others use the oxidative mechanism that influence their aggressiveness and treatment response. So even in treatment, when you consider multiple modalities, whether it is chemotherapy, immunotherapy, that is ICI, or targeted therapies, each one works differently based on the patient and the tumor characteristics. Also, talking about inflammation, when it is a systemic inflammation, we look at markers such as CRP, and high inflammation versus low inflammation, they create a clinical context outcome. So basically these are few of the domains in which we look when we are looking at a precision nutrition category. Again, when we talk about cachexia and severe muscle wasting combined with a significant weight loss, which is often seen in cancer, and therefore the body is literally breaking down muscle tissues for energy. Even for a sarcopenic obesity patients, there is a paradox of losing muscles while gaining and maintaining high fat. So even if a person is gaining weight, whether they are gaining fat weight or whether they are putting on muscle mass. So the person may do appear normal in weight, but they do lack in strength and function, and therefore metabolically problematic when they are low muscle mass or there is reduced calorie burning. So this is very, very common, especially in patients who are aging or who have a sedentary lifestyle, and that is how body composition also changes for these patients. Now, tumor cells exhibit two primary metabolic pathway. That is a glycolytic metabolism, where the cancer cells often rely heavily on glucose breakdowns for energy, and even in the oxygen-rich environment. We've all heard about the Warburg's effect and how rapidly the ATP production to fuel the aggressive growth. So, talking about oxidative metabolism, some tumors, particularly certain conditions, utilize fat oxidation through mitochondrial pathways for energy production. And therefore, we need to understand that there are different approaches and treatment towards cancer. And one of the most common one which we come across on a day-to-day basis is the chemotherapy. So traditionally, cytotoxic agents work by attacking the rapidly dividing cell, and these have been usually the backbone of the cancer treatment for many, many years. Now, the immune checkpoint inhibitors. This is a newer approach that unleashes the body's own immune system to fight cancer by blocking proteins and suppress the immune response. Target drugs, that is targeted therapy, they are designed to attack specific molecules targeted to mutation within the cancer cell, and therefore they offer more precision than the traditional drugs that were used. Uh, Also, with regards to CRP, that is a C-reactive protein, which is a key marker to measure the and assess the inflammation levels in the body. High CRP levels indicate an elevated inflammatory response, and which are signal, which signal there is an infection or there's injury or there is a chronic inflammatory condition. When you look at a low CRP levels, you know that there is the inflammation is controlled, the inflammation is decreasing, and the patient is getting better. These results helps us to understand that the body immune activity and treatment decisions really matter to us. Microbial disruption. So when dysbiosis occurs, when we see a lot of microbial diversity, a decrease in the beneficial bacteria and an overgrowth of the pathogenic bacteria species, there is an imbalance that is found. And therefore, the benefits here of the short chain fatty acids are very crucial for maintaining the intestinal barrier. When we talk about the endotoxemia, that is when the barriers weaken because of the bacterial production from the gram-negative bacteria into the bloodstream. So we also talk about the result of malabsorption of fat and micronutrients along with the GI symptoms like diarrhea and mucositis. And ultimately, this disrupts the critical gut immune nutrition access, which is very, very essential for health. So to manage the dysbiosis, here is where you can look at the healthy microbiome and give variety species of naturally occurring bacteria. And the goal is always to have a diversity from different bacteria and think of an ecosystem which will help the microbiome to come back to its original. So here we talk about the processes that ensure that we move from assessment to action in a very systematic manner. Talking about the patient profile, if you look at a patient who is cachectic and muscle wasting, along with glycolytic tumor, and uh, it also would be the CRP levels would be elevated. You need to do an assessment of these patients. Also, you need to give a proper prescription, which is precision based. That is a high protein to combat the muscle loss, to support the recovery, paired with an anti inflammatory food to address the elevated CRP levels. And this targets both the metabolic demands as well as the disease condition. So, when we talk about the immune therapy, also effectiveness, look at the gut diversity, adequate protein, fiber rich foods, uh, polyphenol supplementation, or an anti inflammatory diet will be supportive in these cases. Uh, Prevent cachexia. So there's cancer cachexia where there's muscle wasting. You need to give at least 1.2 to 2 grams of proteins per kg of their body weight. Reduce oxidative stress. Use omega-3 fatty acids. You can use natural food sources, fatty fish, flax seeds, walnuts, okay, which will protect from oxidative damage. Talking about the target therapies like EGFR and the other inhibitors, where drugs are used, cancer cells do develop a mechanism in which when you give a proper nutrition, it will help to maintain the drug efficacy and prevent the cancer cells from adapting. So here also an anti-inflammatory diet will be very useful. Uh, it is always a good idea to start as soon as possible, especially 5 to 6 days before surgery. Use critical components can be used: arginine, omega-3, fatty acids, nucleotides, which enhance the immune response, and therefore giving these immunonutrients before surgery is of great importance. We can focus on oral nutrition supplements also when we are not able to feed through the diet, only. So we can use strategies like fortified smoothies, where we use the seeds, we use protein powders, we use fruits, naturally fruits. We can enrich our normal khichdi with a little bit of good fats and energy dense foods. Okay, so fortify, whether you're giving poha, upma to the patient who would love to eat those things, but we know those are carb centric foods. So we can add some good amount of proteins through a isolate, or through proteins that can be given, like a vegan protein can be added to the foods themselves. The other functional foods which have got a very strong backing is resveratrol, found in grapes, berries, peanuts, and there are studies which have shown that using a lot of resveratrol-rich foods are really helpful. Even in India, using like foods like jamun, which is locally available, is a good source of resveratrol. Talking about lycopene, we know red vegetables, tomatoes, watermelons, even guavas, they act as a natural antioxidant. And there is a lot of work going on, especially in terms of prostate and breast cancer patients. Sulforaphanes, which is a cruciferous vegetable group from broccoli, cauliflower, cabbage, which induce the phase 2 enzymes that help to detoxify carcinogens. Yes, there is a lot of work still going on in it, but whilst the evidence is promising, we can routinely use these foods in our diet and enhance our diet. Uh, Talking about functional foods, we spoke about the omega 3 and its benefits. We spoke about antioxidants from green tea, natural turmeric, uh, which we use healthy in our daily food, berries, colorful fruits and vegetables, natural probiotic from curds, some kanji, some pickles. These are also recommended. Of course, the IAPN guidelines 2021 bring a whole group of foods. If you're interested, you can read that, which also talks about turmeric, ginger, our natural ghee that is available, which gives you calorie dense foods, can be added to the food. Also, when we talk about protein rich foods, we have a rich source of proteins from all our pulses, from our dairy foods, whether it's paneer, dahi. Those who eat non vegetarian foods, they can include fish, eggs, and chicken. I have heard patients who come to me and tell me that after they have been diagnosed cancer, they have completely stopped non vegetarian foods, which is a myth, and they should include these foods. What they need to stop is the processed non-vegetarian foods, which are actually harmful to them. So, avoid the nitrates, nitrosamines, and avoid the preservatives and the extras that are being added to the food. But do include micronutrient-rich foods, whether it is your colorful fruits and vegetables, mango, guava, amla, vitamin C rich foods. These are all foods that are recommended for patients, which are easily locally available in the market, and which will not even have a it will not be a burden to the pocket of the patient. Since we all know that we in India have a lot of patients who are not under any insurance scheme, and they really need to struggle for getting locally available foods which are nutrient and dense rich, and that's what we should concentrate on. Other organizations have helped us give us a lot of guidelines, but when we are personalizing and when we say that one size doesn't fit all, I ask the cancer patients to look around, look in the local markets, and look out for these kind of foods which are really going to help them to prevent any cancer. You know, if you have read the IAPN India Consensus Comprehensive National Framework for Oncology Nutrition, it's really excellent. It talks about the three pillars, which is science-based standards, cultural sensitivity, and multidisciplinary authorship. So I think this is an excellent chapter to read from the Journal of Nutritional Research, given by our own very India, and the Indian team has been successful to give some kind of guidelines to people who are struggling with cancer. And yes, last but not the least, we have to look at personalized nutrition, precision nutrition in oncology, by integrating the nutrition into everyday cancer, in everyday life, to prevent cancer or to manage its disease conditions. Personalize every work. If you can afford doing a genetic testing, go ahead for it. If you cannot afford, we take other parameters, we do detailed history, we do the ABCD and find out what fits you. The ABCD is the best tool to actually do a personalized nutrition if you cannot afford a genetic test, or you cannot afford the expensive diagnosis of body composition, etc. We have the hand grip, we have the measure tape. Those can be used, to actually do give precision nutrition to our patients. Research is going on, and we do look at recommendations which are grounded from the IAPN, SPEN, ESMO, and ESCO guidelines to help us to get the evidence-based nutrition to the cancer patient. Thank you for a patient listening. Get in touch with me. Also, you can purchase my books on dysphagia, transplant, and vegan books on either on Kindle, or you can get in touch with me. I will give it to you. If you want to know about what we are doing next and what are the other lectures that are happening, please do follow Academy of Nutritional Science on Instagram, or you join the WhatsApp group. They will definitely help you out with the upcoming lectures. I thank you very much for listening to me.